In the fourth year since the onset of the COVID-19 pandemic, the United States has decided to end this public health emergency in May. However, the U.S. government's handling of the pandemic has left endless regret before the end of the emergency, as over 1.1 million U.S. citizens have lost their precious lives. The heinous figure is greater than the total number of Americans killed on the battlefields of two world wars, the Vietnam War and the American War of Independence combined, and accomplished in a time span shorter than any of the wars alone. Top U.S. infectious disease expert Anthony Fauci bemoaned the mass mortality of COVID-19 at the end of last year before stepping down as head of the U.S. National Institute of Allergy and Infectious Diseases.
And I don't think any of my colleagues imagined that we would see a 3-year saga of suffering and death and 1 million Americans losing their lives.
The mass mortality reflects not only inappropriate U.S. policy choices in response to the pandemic, but also the deep-rooted causes of the deteriorating health situation in the United States over the past decades.
عدم سيطرة الحكومة الأمريكية على كل الولايات ده اللي يمكن سبب في انتشار الفيروس إلى حد كبير، وأيضا عدم اتخاذ الولايات المتحدة الأمريكية إجراءات سريعة لمواجهة الفيروس منذ بدايته.
US deaths from COVID were 375%, almost 4 times higher than would have been expected from the number if it had been in line with the world average. That is a profound US attack on the most important of all human rights, to be alive.
Politicization and polarization have defined the White House's approach towards the pandemic. Misinformation of masks and vaccines have caused severe division among states and an even more polarized political environment between 2020 and 2021.
I think the biggest problem was the way the US approached COVID, that it was highly politicized.
We all know how former President Trump characterized the virus in many unfortunate respects. And at that time, the science was set aside and the global politics basically took center stage. And then, of course, the commercial interests around developing vaccines and distributing vaccines then took another turn. So you're looking at science being relegated to the backdrop and politics taking center stage.
Political interference, incomplete information, and confusing messaging all undermine public trust in the White House. Rochelle Walensky, who was appointed as the CDC director by U.S. President Joe Biden, has publicly criticized her agency's handling of the pandemic, acknowledging that the agency has fallen short in response to COVID-19. Fauci, as White House chief medical advisor, also pointed out the consequences of the divisiveness before his step down.
When I see people in this country, because of the divisiveness in our country, of not getting vaccinated for reasons that have nothing to do with public health, but have to do because of divisiveness and ideological differences, as a physician, it pains me.
Politicians made wrong decisions, people paid with their lives.
Bilgi kirliliği, yani o algıya oynamak, bilgi kirliliği yaratmak, Burjuva politikacılarının evvel ezel çok iyi becerdiği şeylerden bir tanesidir. O anlamda da onlara gülüp geçmek gerekiyor sadece.
For the Biden administration, the public health emergency is about to end, but for the public, health risks are still there. According to the CDC, COVID-19 was the 6th leading cause of death in the United States in January this year, and it remains a public health priority and has contributed to a decline in life expectancy.
So the American populace generally was left very confused with the conflicting messages, and the effect of it was that people just continued dying.
According to CDC data in February, the United States was averaging about 33,700 new COVID-19 cases, 3,500 hospitalizations, and 344 deaths each day.